Why is bone TB diagnosis so difficult? Bone tuberculosis, often referred to as bone TB, presents a unique challenge for diagnosis. This is largely due to its clinical presentation, which can be quite nonspecific and develops gradually. Early symptoms such as localized dull pain, swelling, and general signs like fever or weight loss are common. However, these symptoms are not unique to bone TB and can easily be mistaken for other musculoskeletal conditions, leading to delays in recognition. Several factors contribute to the difficulty in diagnosing bone TB. First, the nonspecific symptoms can overlap with many other diseases, including arthritis or even cancers. When patients experience pain and swelling without clear systemic symptoms, it can be misleading for healthcare providers. Second, conventional diagnostic tests, like bacterial cultures and smear microscopy, are considered the gold standards but have limitations. These methods can be slow and may not detect the bacteria promptly. Bone lesions often contain caseous necrosis, which reduces the yield of bacteria. Cultures can take weeks, which delays diagnosis and treatment. Imaging techniques such as X-rays, computed tomography scans, and magnetic resonance imaging can help identify bone destruction and soft tissue involvement. However, these imaging methods lack specificity for tuberculosis. Early radiographic changes may be minimal or even absent, and the findings can resemble other infections or tumors, making it hard to pinpoint the exact cause. Obtaining samples for a definitive diagnosis can also be challenging. A biopsy of bone or joint tissue is often required, but this procedure can be invasive and is not always feasible, especially in resource-limited settings. Additionally, delays in specimen transport and processing can further complicate timely diagnosis. Molecular tests, like expert MTB-RIF, have improved detection speed but often have lower sensitivity in extrapulmonary tuberculosis sites, such as bones. This means that negative molecular test results do not necessarily rule out bone TB. Another complicating factor is the overlap with pulmonary tuberculosis. Many patients with bone TB may also have lung infections, but some do not. This limits the usefulness of sputum testing for diagnosis. Lastly, in many areas where bone TB is endemic, access to advanced diagnostic tools and trained personnel is limited. This often leads to a reliance on clinical judgment and less definitive tests, which can result in misdiagnosis or late diagnosis. Because of these challenges, bone TB is frequently diagnosed late, which can lead to severe complications, including joint deformity, neurological impairment, and loss of function. Early and accurate diagnosis requires a combination of clinical suspicion, imaging, microbiological and histopathological examination, and sometimes molecular diagnostics. Ongoing research is focused on developing faster, less invasive, and more sensitive diagnostic methods, including non-sputum biomarkers, to improve outcomes for patients with bone TB. If you suspect you have symptoms related to bone TB, it is crucial to consult a healthcare professional for personalized medical advice.